You could be walking around with tuberculosis and not even know. Sounds unbelievable, but it's true. Hello everyone, the doctor next door. You see, tuberculosis doesn't always announce itself as a dramatic cough or coughing of blood. That's because at this early stage, many people feel perfectly fine. Some will say it's stress, others will say it's malaria, some will say it's a stubborn cough. And that's what makes TB very dangerous. According to WHO, over 10.7 million people developed TB worldwide in 2024. And in that number, over 1.23 million people died from the disease, making TB the world's deadliest infectious disease caused by a single germ. Shockingly, about 1/4 of the world population carries TB bacteria, but most are in latent TB, that's otherwise called the resting phase. These people have no symptoms and are not contagious. However, some will develop active TB during their lifetime, especially if their immune system becomes weak, caused by other diseases. You must understand that TB spreads through the air. When someone with the active TB either coughs, sneezes, talks, or sings around you, and it's common in crowded areas like our markets, our churches where we sing, shout, and even ACs helps to push these diseases. The worst part is that you don't need to touch the person to get infected. A poorly ventilated area with crowded people makes you prone to getting the infection. So please don't ignore these warning signs I'm about to tell you. Number 1, if you're having cough that is lasting more than 2 weeks, please, it's not a stubborn cough. Go to the hospital and run a TB test. Number 2, night sweat. In fact, we call it drenching night sweat. You notice that while you're under the fan, you're still sweating. Please rush down to the hospital and run TB test. Number 3, unexplained weight loss. That shirt that used to tight you before, you notice that you are now looking like Mangala inside it. Please rush down to the hospital for TB test. Number 4, fever. If you notice that you're having mild fever, especially at night, rush down to the hospital and run TB test. And number 5, if you notice that while you're coughing, you're seeing blood, please rush down to the hospital and run TB test immediately. And the frightening part about TB is that it creeps in slowly into your system and stays there for weeks or even months without you knowing. You just be spreading the disease before seeking medical help. The good news is that TB can be prevented, TB can be treated, and TB can be cured. But then, the earlier the diagnosis, the better the outcome, and the lower the risk of spreading it to our loved ones. TB test is free in our primary health care and government institutions because a cough can be ordinary, but a cough that won't go away deserves attention. With Dr. Next Door. I would love to hear your thoughts about TB in the comment section. See you in my next video.